In this video, you will learn how to prepare and use the ROADSAVER Carotid Artery Stent and NANOPARASOL Embolic Protection System when used together during a carotid artery stenting procedure. The NANOPARASOL Embolic Protection System comes packaged with the device and delivery catheter in one sterile pouch and the retrieval catheter in a separate sterile pouch. To prepare the NANOPARASOL Embolic Protection System, first, peel open the sterile pouch containing the NANOPARASOL device and delivery catheter. Remove the dispenser coil. Set aside the introducer. Fill a 5 mm syringe with sterile heparinized saline and remove air bubbles from within the syringe. Attach the syringe to the lure lock on the EPD loading cover. Orient the EPD loading cover and syringe vertically and inject slowly into the EPD loading cover. Make sure all air bubbles from the filter are removed and continue to flush until saline is seen exiting the rapid exchange port of the delivery catheter. Unclip the torque device from the dispenser coil and ensure that the torque device is secured onto the capture delivery wire. While securing the dispenser coil, pull on the torque device until the filter is withdrawn through the EPD loading cover and a hard stop is felt. Next, remove the blue wedge from the dispenser coil. Withdraw the EPD system and set aside until you are ready to backload the NANOPARASOL device over your 014 guide wire. Load the EPD system over the primary 014 guide wire, ensuring the primary guide wire exits the proximal rapid exchange port of the delivery catheter. While maintaining position of the primary guide wire, advance the EPD device and the delivery catheter slowly and deliberately beyond the lesion to a minimum of 8 centimeters. To prepare to deploy the NANOPARASOL device, first remove the primary 014 guide wire. Next, loosen the torque device. Now hold the proximal delivery catheter end with the captured delivery wire. Reposition the torque device against the hemostatic valve and tighten it onto the captured delivery wire. This will ensure proper wire support for the deployment of NANOPARASOL. To deploy the NANOPARASOL device, fix the position of the torque device and pull on the delivery catheter at an angle of 30 degrees relative to the exit port of the torque device. Verify that the filter is fully expanded and opposed to the vessel wall by visually confirming the shape of the filter markers, which should appear in a W shape, spread shape, or V shape. If needed, please rotate the view and reconfirm. Completely remove the delivery catheter by continuing to withdraw the delivery catheter until the catheter is completely peeled through the torque device. Use caution to minimize any movement of the NANOPARASOL device. You may feel increased force when the rapid exchange port is peeled through the torque device. If you have successfully peeled away the entire delivery catheter through the torque device, you'll want to loosen the torque device and remove it from the captured delivery wire before using any interventional devices. The ROADSAVER Carotid Stent should be sized to the vessel according to the reference vessel diameter range listed on the product label. Remove the ROADSAVER pouch from the carton. Peel open the pouch and remove the tray. Move the guide wire lumen mandrel from the proximal rapid exchange port. Attach a 5 mm syringe filled with sterile heparinized saline to the hemostatic valve lure and flush the delivery system. Apply positive pressure until saline weeps from the valve seal of the hemostatic valve. Close the seal of the hemostatic valve. Continue to apply positive pressure until saline weeps from the proximal rapid exchange port. Pinch the proximal rapid exchange port and continue to apply positive pressure until saline weeps from the distal tip. Now, carefully remove the delivery system from the tray and remove the catheter from the tubing without kinking the catheter. Load the ROADSAVER delivery system onto the proximal end of the NANOPARASOL capture wire and advance the ROADSAVER stent to the target location. Foreshortening of the stent should be taken into account when positioning the stent relative to the target location. Ensure that there is a minimum 2.5 centimeter gap between the proximal end of the NANOPARASOL device and the distal tip of the ROADSAVER delivery catheter. Ensure the RHV is open to reduce friction with the outer catheter, as the stent is deployed with outer catheter retraction. To deploy, maintain the position of the inner catheter by holding the handle fixed and retract the outer catheter to allow the stent to begin to expand. The stent foreshortening should be taken into account when sizing and deploying. To recapture the ROADSAVER stent, first remove any slack in the delivery catheter shaft. Then maintain the position of the inner catheter by holding the handle fixed and push forward the outer catheter. After the ROADSAVER stent has been completely deployed, using fluoroscopy, recapture the delivery catheter tip into the outer catheter by pulling the handle. Withdraw the delivery system carefully, leaving the NANOPARASOL device in place. Peel open the pouch for the NANOPARASOL retrieval catheter and remove the dispenser coil. Remove the introducer, then carefully remove the retrieval catheter from the coil. Fill a 5 mm syringe with saline, ensuring no air emboli remain in the syringe. Insert the distal tip of the retrieval catheter into the syringe tip and seal with your fingers. Inject saline until it weeps from the rapid exchange port. Load the retrieval catheter over the delivery capture wire. Advance until the distal marker reaches the NANOPARASOL filter. While maintaining position of the retrieval catheter, pull on the capture delivery wire to withdraw the filter into the retrieval catheter. Withdraw until the filter is fully captured or resistance is felt. Complete retrieval of the filter is achieved when the filter marker has been withdrawn proximal to the radiopaque retrieval catheter tip and a stop or resistance is felt. Remove both the EPD and the retrieval catheter simultaneously out of the access guide catheter or introducer sheath. This concludes the procedural training on the ROADSAVER Carotid Artery Stent and the NANOPARASOL Embolic Protection System.